Checkup by BOQ Specialist, a series of podcasts created specifically for current and future doctors, dentists and vets. Internship can be physically, intellectually and emotionally challenging. In Australia, all medical graduates must successfully complete an internship before becoming registered with the Medical Board of Australia. How do you feel ahead of this leap from student to professional, and do you know what to expect as you embark on your internship? That's what we're here today to discuss.
I'm Peter Peters, New South Wales student and grad banker at BOQ Specialist, and in having this discussion today, I feel it is relevant to get the perspective of both a current medical student soon to embark on an internship, as well as the perspective of current interns and doctors working in the hospital system. I'm excited to be talking today with Dr. Lucy O'Connell from Tamworth Hospital, Dr. Ed Lewis from St Vincent's Hospital, Dr. Madeline Temple from Bankstown Hospital, and Jasmine Jansen, AMS's 2020 Executive Sponsorship Officer and about to embark on her final year of being a medical student. So, you finish your university studies, maybe take a couple of months off before commencing your internship in the new year. This internship is to last 47 weeks, of which you must complete a series of rotations in a range of specialties. You must complete at least 10 weeks of each rotation in medicine and surgery, and at least 8 weeks in emergency medical care. While there are no examinations, your progress and professional development is constantly being assessed in a work-based setting, and to successfully finish, you must complete the time requirements and demonstrate acquisition of the skills and knowledge expected. Whew, sounds pretty intense, Jasmine. How are you feeling about all of that? And are you looking forward to it?
Pretty nervous, but excited as well. I think so I have one more year left of my med school degree, and hearing everything that we're going to be doing once we finally finish is daunting, but I think it's like a nervous, excited energy. So I'm very excited to hear more about what I should be expecting and what that first year out is kind of like.
Yeah, totally. And I think, at least, as you said, you've got another year to go for, so the preparation will continue. I might throw it over to Ed, who finished his internship last year, was it?
Yep, last year, finished in Wollongong.
Beautiful. So, with regards to your own experience, is there anything you can share when you first started and how that went?
Well, I think nervous energy is probably really the right word for it. You're going into a bit of the unknown, even though you've been preparing to be a doctor for all those years. So a big part of it will be getting used to the hospital system, getting used to full-time work. At least in New South Wales, they do a really good orientation program at most hospitals where you can shadow people for the first week, and you'll basically learn from the people that have gone in the year before you, just in regards to how the day-to-day life works as an intern and what to expect and all the unexpected things as well.
Totally. Might pass it over to Maddie. So how did you feel when you first started and your experiences?
Yeah, absolutely. I would definitely echo Ed's sentiments. Internship is a very daunting experience, and I moved back to Sydney after completing my studies in Newcastle. So it was moving to a different place, meeting different people from different universities who I didn't know, and starting in a new hospital with a very different system from the place that I had trained in. But I agree, we had a really excellent orientation. And I was lucky enough to start and stay in emergency during the start of the COVID pandemic. So it was definitely challenging.
Oh, wow.
But there were really great supervisors and people to support, not only DPETs, but people who met day to day, not even medical, but wonderful nursing and allied health staff who helped along the way.
Oh, good to hear. Lucy, with regards to some of the mentor possibilities and supervisors and so forth, how has that helped with your transition from study to becoming an intern?
I believe mentors, getting advice, having support is so important in that first year. It is such a massive transition, and it can be really daunting at the beginning. And I've started my internship this year in Tamworth. So it's a smaller hospital, but I think that was more beneficial in terms of mentoring and things like that, because you get to know everyone really quickly. You find people who you work well with and, perhaps working in the areas that you're interested in pursuing, and everyone is just like this big welcoming family, and they welcome you with open arms, and they just take you under their wing because all they want is the best for you. So that's why, I decided to go to Tamworth for that reason.
With regards to just applications in general, did you guys do a lot of research into it? Did you ask around? Like, what was the best way for you guys to figure out your preferences and order of hospitals for internship?
I think every state does work differently. In New South Wales, especially for the more metropolitan areas, it is a bit of a lottery system. If you want to try and get what they talk about, the top four in somewhere like New South Wales, the larger hospitals, then you have to be prepared to potentially not get that choice because there's just more people applying. It sort of tries to make it as even as it can be, whereas I know that other states like Victoria do have a preferencing system where you interview and it's also based on marks as well.
And Ed, when you were doing your applications, did you have like an idea of the hospitals that you preferred because you'd had like rotations there? Because like as Lucy mentioned, she'd previously done a placement in Tamworth. Did you have similar reasons why you ended up in Wollongong for first year and then St. Vinny's this year?
No, I definitely did not get my top preferences going to Wollongong, but it was a blessing in disguise. I think I learned a lot in that year, and it was a nice change for me because I actually was a student at St Vincent's. I think it probably opened my eyes up to a different career path than I probably thought I was going down initially as well. So it is possible to change in residency in New South Wales, but a lot of the hospitals sort of don't really probably agree to it because it is a 2-year contract initially. But it can be done for whatever reasons, whether that's sort of career or family or other factors as well. That's basically my reasoning behind that anyway. And it was a good move. I enjoyed it down there. It was busy, but it prepared me very well for hospital life.
Just before starting your internship, was there any way that you prepared in the week beforehand? Was there anything you did in preparation, or you just turned up on the first day and went to orientation?
One massive tip would be do your mandatory online training module in your holidays.
Yes, agreed. I was going to say, I was lucky enough, my hospital allowed me to do my mandatory training as paid work days. So your hospital might let you do that. But in terms of preparation the week before, gosh, I'll be entirely honest, I think I just enjoyed my time off pre-working. There are some good textbooks that people recommend that can help you prepare, that particularly I think in relation to sort of thinking about working in the after hours context. So when you're a ward doctor on either medical or surgical, getting called to clinical reviews, having to chart medications for patients. I think thinking about those common things that you'll be called for so that you're not arriving first day, seeing this patient, you know what to do because you've been trained in how to do it. But just having something that you can do as an easy recall, someone's got hypertension. What's something that if it was a simple case after you've assessed them, what drug would be the most common thing that you'd give them? Thinking about those common presentations to do with blood pressure, someone's respiratory rate, if they've got a temperature, having some sort of formula that as you're walking towards the patient after you've gotten that terrifying pager is always a good thing to be able to rest on when your blood's pumping, you're rushing, thinking, oh my God, what am I going to do? It's nice to have that thing to be able to rest upon and make yourself feel a little bit more comfortable. So I'd recommend reading up on that, enjoying your time before working, maybe going to the place the day before to make sure you're not late, whatever you decide makes you feel the most comfortable. For example, this is sad to say, but I'd never been to Bankstown. So the week before, I just decided I'd see how long it took me to drive in the morning, and it took much longer than I thought it would. So that was the way I prepared.
Yeah, I agree with Maddie there. I think it's really important that you enjoy that time off because it's the last time you'll get such a big chunk of time off for the rest of your life until retirement, probably.
Yeah, you don't need to cram anything. There's no cramming required before starting internship.
No.
Yeah. Don't think of it as study. Don't sit down and have a study day. Yes, having a kind of idea of, what to do with the common things that go wrong on the ward is really useful, but none of that will make sense until you actually start doing it and you start seeing it in real life.
Yeah, there is a good book, Junior Doctor's Survival Guide. I think it's written by to Australian doctors, and it does give a few good tips on, it's broken up into specialties and also into simple procedures that you'd probably be expected to do. So that is a good one, just to get your head around if you need to call someone and what would they expect you to know in terms of a consult, all those things.
Yeah, the other one's on call as well. That's also quite a good textbook.
That's another good one.
But I agree with Lucy. Just enjoy your time. I would say really keep in contact with your friends, because they're going to be the people to support you during this difficult first couple of weeks. They can be the people that you call after your really long shift and you say, I had no idea what to do with Gladys. She really scared me today. You know, those are the people who will understand what you're going through and will be able to relate.
Yeah. How did you find with the first few weeks? How did you find the hours and like emotionally? And
I think my first clinical situation, which had nothing to do with anything that you'd find in a textbook or medicine, was this irate person on the surgical ward that hadn't had a smoke for a few days. And they just had a big surgery and they were definitely withdrawing from nicotine, and all they wanted to do was go and have a cigarette, and I couldn't let them leave the ward. You know, I just had no idea how to deal with that kind of situation. And what you'll find is that there's a lot of things that come up that you have no clue how to deal with because you've never done it before. It's never been part of a tute or anything like that. And sometimes you just have to go, I'm not sure what to do here. And it comes back to sort of knowing the people around you. And a lot of the nurses will know that you're fresh. There's a form that basically says that, you know, if you go outside and smoke and something happens to you, that's a disclaimer. So there's always a solution to most problems, but some of those problems you'll just never have come across until you're actually thrown straight into it.
Yeah, I absolutely agree. I started, as I said, in emergency. And I remember my first patient was dehydrated and I didn't know if I could prescribe fluids. It was just this terrifying first day thinking, oh God, if I give someone sodium chloride, something's going to happen to their sodium and then they're going to have a seizure and oh God, who knows? And I remember talking to my lovely new colleague and we both looked at each other and we just said, are we mad? Are we going crazy? Because we were both in the same scenario. So I think, like Ed said, you've got these amazing, experienced people around you who will tell you how to send bloods because you have no idea where the tube is, and will tell you how to fill out the form for a workers' comp claim when you have no idea how to do it, or take bloods for someone that's had a car accident. There'll be all these scenarios where you're not sure how to do it. And the great thing is there's these people who've had 17 years experience who are sitting there waiting to help you as long as you just ask nicely and politely.
And they might laugh at you, but that's fine.
Yeah, absolutely.
how long would you say it took for you to feel comfortable in your role as an intern?
Oh, don't ask me that question. I think maybe I had a different experience because having done 2 terms because of COVID, I stayed. Definitely sort of going into that second term knowing, okay, I've been here for a term, I feel really comfortable. I started to definitely feel good about what I was doing, get into a rhythm. But then, you know, there'll come along a case where you haven't seen it before, you're not sure how to approach it. And to be honest, it maybe knocks you down for a rung a little bit. You realize that you don't know as much as you know, and that's actually a good thing. You don't want to be sitting there thinking, oh yeah, I'm fine, I know exactly how to deal with it, because you realize that's what it takes to become at a consultant level. It takes time, it takes experience, and you're always still surprised by these new cases and new experiences. And each of the medical, surgical, and emergency rotations you do, you'll feel a bit junior for a little bit of time, and as time goes on, maybe that period of time of adjusting will get shorter and shorter. Coming towards the end of the year now, I'm definitely feeling more confident and feeling more comfortable. You learn a new thing every day.
Yeah, I reckon it took me sort of 2 to 3 months.
What I found happening is that I would get to the end of my rotation, I'd be super settled, super comfortable, and then, now you've got to switch teams. You've got to go to a different department with a whole new set of patients. You know, it nearly felt like restarting your internship again. And you were back at that place where you had to ask everyone, you know, where things were, what to do. But it became shorter and shorter each time, you know, because you had that general experience in the hospital. But there will always be new things to figure out and new systems to work with, whether it's like your online systems or different departments will have different ways of taking notes, all that sort of thing. So you are constantly having to, you know, readjust and that sort of thing. But overall you build this gradual like baseline level of confidence that just keeps growing and growing as the year goes on.
Yeah, and I guess like to a certain extent, kind of having to adjust to new situations is going to happen throughout the whole of our careers as you move through different hospitals and things as well.
Yeah, definitely.
I might jump back in quickly. So is there anything else with regards to the relationships that you have in the hospital? Is there anything you can add with regards to that?
I was talking about this with my housemate, who is another resident, and we came up with this thought that it's almost better to be nice than smart. And what that basically means is that you really only get one chance to create a first impression with people. And if you do treat everyone with respect and you're kind to people, they'll remember that and they'll try and help you as much as they can, because you will come across things where you're just not sure. And there's just no need for rudeness, or even when you're stressed or under the pump, being short with people. I think people know that it's a hard job being a doctor, whether you're a consultant or you're a junior. People know that you're busy, but they will go out of their way to assist you, whether that's a nurse, whether that's a physio, OT, social worker, dietitian, anyone. I think if everyone is on the same page and has respect for each other, then it does make your job easier as well.
Yeah,
absolutely. Understanding that everyone kind of has, from your JMO who's covering the whole hospital alone after hours, with your nurse who's looking after 5 different patients, with your registrar who's waiting for an update. Everyone has different priorities in the moment, and you've just got to remember that at the centre of this, everyone is trying to do their best for their patients. So that nurse is paging you because they're worried about their patient, and that's their priority, whereas your priority is, you've got 100 patients to, keep alive until the next morning.
Yeah, 3 others with chest pain, and they're, wanting a cannula done for antibiotics due in a few hours.
Yeah, that's right. So I just had to find, especially on those after-hours shifts where you were really busy, you have to remember that everyone's just trying to do the best by their patients, and that's no excuse. You're busy. That doesn't mean you have to be rude and short, like Ed said, because everyone's just trying to look out for the patient, which is what we're all meant to do at the end of the day.
How did you find your first night shifts as an intern? Because I guess in med school, you don't really have much exposure to it. So it's really an internship. Or any tips you have for your first night shift?
Oh, caffeine's your friend.
Yeah, I agree. Caffeine's definitely your friend. A really nice thing about night shifts is the sense of camaraderie that's developed. You're all in it together. It sucks a little bit, but you're all doing it together and it's quite nice. I've done nights both in emergency and on the wards. My first ones were in emergency, and it's a different breed of people that come out at that time of night. So it's different experiences, it's different challenges. So I would just say be aware of that, and you'll sometimes have some funny social circumstances, but they're always good fun to get through. Trying to just look after your health during those periods of time. These stretches of nights, whether they're one night isolated or 7 nights in a row, you have to remember that you can't put your life on hold necessarily just because you're doing night shifts. You might feel like you just want to sleep all day, but I definitely encourage people to try and eat well, try and get okay sleep if you can. Get out the next morning, it's sunny, go for a run and then go to bed if you can. It sounds exhausting, but I think it'll help you feel like you're not in this black hole the whole time you're doing your night shifts.
And stay hydrated. Sometimes, the JMOs are more anuric than some of the patients. So, yeah, you do have to look after yourself.
This is something that's been on my mind throughout med school as we've gotten more and more clinical exposure, is kind of like, obviously at some point you might see your first patient death. How did you deal with that? And how is debriefing in a hospital in general?
I have a very kind of vivid memory of my first death of one of the patients I was looking after. It was the end of week 1 or maybe week 2 of internship. So it was pretty early on, and it wasn't exactly, an expected death. And the patient specifically, wasn't for ICU help. I was kind of the limit of care. So, being called to them, a patient is feeling that they can't breathe properly and all of this sort of stuff. It's very, it's not nice. And especially your first time when you don't really have that sort of experience to know how to kind of process those things, it can be really tough. And I think what made it especially tough was the family were in the room at the time when the patient passed away. And obviously they kind of went into shock and they started telling me all about the patient's life and what she did and all of this sort of stuff. They were kind of, in their shock, just unloading all of that to me. And, I kept it together in the room. But then as soon as I walked out of the room, my registrar, who had been kind of waiting outside because he was somewhere else when this all happened, he kind of just looked at me and said, "Oh, are you okay?" And as soon as someone asks you, "Are you okay?"
Yeah.
that's when it all comes out. But I was really fortunate. That particular registrar, he was so supportive and helpful and kind of understanding to what I was going through. He took me to a private room. He's like, "Just let it out, just cry, and then we'll have a chat." And so it wasn't like a formal sort of debrief. It was just, an informal, take you to the side, have a chat, and he said, "I don't want you to, keep all this in. I want you to tell me everything. Tell me how you felt. Tell me how it's making you feel now. What do you think about what happened? And what are you going to do moving forward now?" So I found that really helpful. And it wasn't a formal process within the hospital that time. It was just, an informal thing with my registrar. But I do know that, after things like that happen, the ward usually arranges like a formal debrief with all the nurses and everyone who was involved. But I find those more informal ones more beneficial, just because I felt really safe, to be honest. And it was just nice to know that, I didn't have to suck it up and pretend it was all okay.
Yeah, I'll echo basically what you've covered there. A similar situation happened with me early in my internship. I had an incredibly supportive medical registrar at the time as well that sort of sat me down and we sort of went through things. And you do stew on it a little bit. And that's, I think when you're new, that's okay because it will allow you to move past it eventually. Don't feel that you're alone. Everyone else that's gone before you and everyone that will follow you will go through a similar experience. So there are people that are willing to debrief with you and talk to you. And it's a really important part of junior doctor wellness and welfare that there are people that will listen if you do find yourself in situations where, you're not coping, definitely.
A really challenging time is if you're the one that's certifying the death and has to call the family to notify them that the patient's passed away. It's something that you can't prepare for. And it's a difficult experience because, unfortunately, the nature of it, you have to both achieve your clinical goals, notifying them as a legal obligation that the patient has died, as well as comforting these people that perhaps you don't even know, and unfortunately not always face to face. And I think that can be really tough. I remember the first time I had to do it, I didn't even know how to approach it. It's not necessarily, you get taught on these tutorials, breaking bad news and starting with something to sort of warm up to the conversation, however you might have been taught in medical school, but actually experiencing it firsthand is really different. And I think it's always important to know that you can ask other people in that context, speaking with, a medical registrar, a surgical registrar, whoever it might be, but knowing that that's a really important moment in a patient's family's life, hearing that news for the first time. And I think just getting yourself a little bit prepared for it and knowing that over time you'll become more comfortable, perhaps being able to make that call is something that I think all interns should know.
Yeah, that would be a horrible thing to have to go through, but it sounded like at least you can have comfort in the fact that they did have the support around, which is good to hear for you all. With regards to additional education throughout your internship, do you get a lot of pressure to complete extracurricular activities throughout that year?
Or doing research and extra degrees or masters on the side and things like that?
Just enjoy working. Just enjoy working for the first time and earning some money and getting immersed in junior doctor life, get involved in things like a Resident Medical Officers Association, societies. If there's any interesting committees that you might be passionate about that run at the hospital as well. I don't think you necessarily have to study in internship formally. You learn so much on the job, and a lot of it is just experience. You have all your book knowledge there from being a student. It's just about getting used to that system and preparing yourself for future education, really. Depending on what career path you would want to go down, then you can look into courses, but you don't actually get study leave as an intern. But from residency, you actually are allowed to, I think it's about a week of study leave to do a course or go to a conference that you wanted.
Give yourself however much time you feel you need to get used to what it's actually like. Working is very different to being a student. It's long hours, different responsibilities, but give yourself a little bit of time. And then I would say focus on thinking about what you want to do. Try different experiences, get to know different people who are in the fields that perhaps you have interest in. Speak to the registrars about what their life's like, what their job's like. Maybe even speak to the bosses and network. You know, it's really great, even in internship, to be able to get a reference for when you're trying to apply for jobs as a resident, or actually work out, okay, what do I like? What do I not like? What am I thinking about in the future? I don't think you have to rush into a master's or courses. So I'd say take the time and enjoy. I completely agree with Ed.
Yeah, definitely. The last thing I wanted to do when I finished uni was more study. So I said, this year, I'm not going to do any of that formal stuff. I've done one, weekend advanced life support course, but that's about it. Especially for those first few months, you don't have time for that. You need that time to just wrap your head around where you're going and how to, function as a human now that you're doing full-time work. Get involved if it's going to be something you enjoy. Don't do it because you feel like you have pressure to put it on your CV or, that sort of thing. Do it because you're passionate about it.
Yeah, absolutely. Couldn't agree more.
Yeah, you don't feel obligated at all to complete any extra research or study throughout that internship year?
I
don't think there's
so.
any pressure.
No. We all did it at once.
That's unanimous.
Yeah, I'll just add that, there's not really pressure to, go and do those extra things, but there is lots of protected education time where interns and sometimes the residents have specific allocated hours where they attend teaching sessions, whether that be Zoomed from bigger hospitals or in person. So I found here at Tamworth, all the consultants are really protective of that, and they make sure that you get to your education, because one of my bosses said to me, he said, you're an intern, you're a trainee, your job is to learn, and that's it, which I hadn't really thought about, but it's actually true. Our job is to learn. So, and that's why he was like, you must go to all your education. It's really important. So, and there's a lot of that. There's many hours of that.
Going back to Ed, because you've made that transition again to what you're currently doing, how does it compare from student to intern to then intern to your current position? Did you feel just as much pressure, or was it a bit easier because you'd already started working and so forth?
Yeah, we all talk about experience, right? Whether you're a surgeon that's worked for 20 years or a physician that's worked for 20 years, what you don't get out of med school is that experience. And it's usually something that you always hear as a student. It's like, well, I know the main causes of heart failure or something, but it's until you actually realize what's important or not in terms of a patient's care is that when you actually start to really develop. You do start to get better at triaging certain problems and realizing what's actually serious and what isn't. And that obviously comes with increased exposure in the hospital system and with certain patients. So it does get easier, obviously, when you're going into further specialist training, whatever field that might be. Things do change again. Every level that you go up, whether you're going from an intern to a resident or a resident to a registrar or to a boss, there's always a step up, and you're always going to feel that little bit of incompetence initially, a bit of imposter syndrome, but you're there for the right reason. And as long as you're putting the patient first, as what we discussed earlier, then you'll do well and you will improve and you will get that experience over time. It doesn't happen overnight.
Ed, you mentioned imposter syndrome. I think that's a pretty big thing in general for med students to feel, especially in that first few weeks. How did you guys find it and kind of work your way around feeling that specific way?
I think the good thing about being a medical student is that no one expects you to really be good at anything, which sounds terrible, but it's probably the truth. when you are a medical student, it's really good to try and get good at the simple things. So simple things like taking bloods, doing cannulas, simple sutures, all those kinds of things, assessing a patient from head to toe. If you get good at that as a medical student, and if you've done so many cannulas before you start as an intern, that will definitely help you in trying to sort of alleviate some of those imposter syndrome symptoms, I guess, because you've already done it before and you will be more comfortable doing it. So it is a problem, and everyone does go through that. It's just how you deal with it. And I think if you're prepared as best as you can, then it will help.
And it is really strange when you're on the wards and the first time, the nurse calls out to you from across the room, doctor, and you kind of double take, like, oh, you're talking to me.
You look over your shoulder.
Right, I'm the doctor.
I think a good way to think about combating some of those feelings, because they will creep in no matter how many cannulas you've done, no matter how many bloods you've taken, no matter how many people you've assessed yourself, they'll creep in. It's always good to have someone to bounce ideas off. If you're starting in the wards and you have your registrar around, or if you have another junior doctor colleague around and you think, oh gosh, should I give this person fluids? Should I give them an antihypertensive? If you just ask someone else, sometimes, they can just validate what you're thinking's the right idea, or they can make another suggestion that you learn from. And that can definitely help you feel more confident over time. And I think it all just comes back to that experience, seeing things over and over again, seeing when people look sick is a really big skill that you learn over time. So I think that would be how I kind of started to overcome it.
Yeah, definitely. I was nearly running, everything I did past someone else for those first few weeks, because I thought, I'm not ready to, make a decision like this. And even though they were just small things like a medication or fluids, but just being like confirming what you think with someone else, yeah, that helped a lot. And then gradually you just needed that less and less.
Yeah, and there's some really good initiatives in a lot of the hospitals now. I know at St Vincent's there's a Rainbow resident program where there's basically a pager that you can call. It's one of the residents that's gone through what you've gone, and they're basically there to help you with certain problems that you might not be sure about. So the hospitals do try really hard to give you those avenues of affirmation that you need if required, definitely.
I think other really useful things are like policies you can find on your hospital intranet. There'll be a million policies about reversing warfarin or starting Clexane or whatever it might be. They might sort of seem like a mountain of paperwork that is lost on some sort of hospital hardware somewhere, but there's a lot of people that have put in a lot of time and effort to kind of come up with these simple pathways that if you're a bit stuck, you can always look at whilst maybe you're waiting to talk to someone else, or if you're stuck on an after hours shift. Those can also be really useful guides.
Yeah, policies, pathways and guidelines, your best friend.
Oh, best friend for sure. ETG, all of them, they're fantastic.
Do you guys have any other little nuggets of wisdom?
I think a really important thing to keep in mind for future interns would be flexible. You might not get your first preference. I didn't. And it can be really upsetting at first. You can have this feeling that, oh, I'm not going to get to know the bosses for the training program that I want to get on. And it means that my whole life is over and I'm never going to be a surgeon. And you can kind of run yourself into this hole. But often you can turn these experiences into such positive ones. You get to learn how it is to be in a new place, in a situation that makes you feel uncomfortable. And I think it shows you that you don't always have to take that perfect linear path to get to where you want to be. I'm on an orthopedics rotation at the moment, and I was speaking with my newly minted set registrar, and he's just told me he's PGY 9. And he's like, yeah, I took my time. I didn't get on first time, but that was such a learning experience. It made me grow, made me realize, what areas I needed to improve on. I think that's something that's really important to keep in mind, especially because getting onto a training pathway nowadays, it can be so tough. You feel like you're just climbing this ladder that never ends, or you're not doing the right things, or you're not going to be as competitive as the next person. But I think remembering that it doesn't always have to be perfect. You can take a little bit of extra time, and you might not always get what you want first time around, and that's okay. If anything, I think you'll be a better doctor because of it, because you've learned to overcome that, I suppose, adversity or that challenge to what you thought was what you needed to do.
Yeah, I agree with that.
Yeah, keep an open mind. with all the rotations that you do, you might end up doing something that you never thought you were going to ever enjoy, and it might just be the best thing ever. And a lot of your supervisors or your bosses or your registrars will probably be quite influential actually in your future profession.
Yeah, I think one thing I didn't realize as much as when I'd started internship was that as interns and residents, you're really one big team and you're all going through it together. And I think it's really important to help your colleagues. You might be having a pretty good day, thinking things are going well, and your friend in the next ward, they feel like everything is melting before them and they can't keep up. And I think it's always important to sort of check in with how people are doing, because you don't know what's necessarily going on. They might look like everything's fine, but it's always important to check in, see how they're doing, because one day it could be happening to you and they could be the person that you lean on or you get help from. Guess that's my tip.
Yeah, definitely. You have to back each other up. It's a hard year, but it's a really rewarding year. A lot of people come out the other side and they think it was just so good. They meet great people, new friends, new colleagues as well. And if you back each other up, then you'll all get through it together, definitely.
You know, you can go out with the other interns, get to know them, and do things that aren't work-related, which
absolutely,
we're finally starting to get to do together now.
For sure.
Well, guys, thank you so much. It's been so great to hear all of your thoughts and your unique insights into your own internship. No doubt Jasmine and other med students are walking away feeling way more informed and confident about what lies ahead. Ed, Lucy and Maddie, wish you all the best with your careers. And Jasmine, all the best for your last year, next year of study. Cheers, guys.
Thank you.
Thanks, everyone.
Thank you.
Thanks so much.
For more information on finance and banking solutions for students and graduates, please call 1300 131141 or visit boqspecialist.com.au/students. This podcast is for general information purposes only and not intended as financial or professional advice. It has been prepared without reference to the circumstances of any particular person or business and should not be relied on as such. You should seek your own independent financial, legal and taxation advice before making any decisions. The views expressed in this podcast are those of the speakers alone and do not represent the views or opinions of BOQ Specialist.